Right, Dr. Jairam, if you could tell us about the current projects of your organization.
See, Columbia Asia is a Southeast Asia and South Asia company, and we have operations in Malaysia, Indonesia, in Vietnam, and in India. At this point, we have 28 hospitals in the region. In India, we have 11 hospitals, and we are spread across the country. We have hospitals in Gujarat, in Ahmedabad, in Maharashtra, in Pune, NCR in Palam Vihar, and in Ghaziabad, in Calcutta. We have a large number of hospitals in the Bangalore-Mysore area, 4 in all in Bangalore and 1 in Mysore. And we would continue to expand in the region. And in India, we have looked at 3 areas for continued growth. That's the Bangalore area, Pune, Calcutta, and NCR.
All right. And what's your reach in the rural areas?
At this point, we are committed to metros and tier 2 cities, and we have no specific plans of entering rural India.
All right. And may I ask you why?
Columbia Asia's model aims at providing affordable health care to the middle class of India, and that's our target population.
Okay. So any plans of reaching rural India with a specific model, because we have 70% of population in the rural area?
We have evolved a small hospital which we have tried as a pilot in the outskirts of Bangalore, and until we see the results of that pilot, it would be difficult for me to say.
What's your expectation? Around the year 2028, we would be the most populous country in the world. Do you think healthcare for all is feasible, or is it a far-fetched dream?
Well, I believe it is possible, provided everybody works in unison. In India, it is unfortunate that the industry is fragmented, that the government and the private healthcare players have not established total trust. And until this trust comes in, until everybody works in unison, such a dream cannot be fulfilled. There are many important steps, from health financing to the delivery of quality healthcare to the needs of the underprivileged, that has to be addressed. But if we do it aggressively, that is achievable.
Right. Do you think FDI in healthcare has helped the sector?
Immensely. It is fair to say that FDI in the health sector is much more easy for foreign direct funds to come in, and it has been a big boost. But it is also important that FDI investment comes in understanding the need of maturity and the fairly long incubation period that the fund would take before it realizes.
Right. What's your thoughts on Swasth Bharat to Sabka Vikas?
I think it is extremely important. It's a great initiative, and it needs to be fueled even faster.
All right. If you could tell us a little more about the organization, as if there's any particular projects for the urban class that you're talking about, and what would be the role of your organization in the 100 smart cities we would be having?
We will look at the smart cities and take a call. At this point, as I've said, we've committed ourselves to growth in the geographies that I've mentioned. What we pride ourselves in providing is a clean and caring environment for obtaining health. We are also committed to working closely with the insurance and with corporates to enhance preventive care and to provide quality health care in our hospitals. We believe working in an ethical environment in these areas would see us to where we want to be.
And how are you taking care of the major challenges, that is accessibility and affordability?
Well, in the geographies that we are in, we always position our hospitals in areas of economic growth where upcoming societies are underserved in healthcare requirements. This has been our way of ensuring accessibility. We price ourselves at what we believe is value for money, and that again at the target group that we serve and I feel that we've done pretty well at that.
All right. Do you have any existing projects or any plans of going ahead with corporate social responsibility in healthcare?
We do have in every hospital corporate social responsibility projects which we review and reapply year on year, and that is a commitment that any healthcare provider should have, and we will have it.
All right. Few do's and don'ts for startup entrepreneurs who are planning to come to the healthcare sector.
Well, make sure that you are very clear about your goals. Do not take shortcuts. Believe in the ethical ways of dealing with people and with all powers that be. Ensure that you do justice in terms of quality and be honest in terms of your costing.